we communicate as men? How do we resolve conflicts? How do we support our spouses? What about fatherhood across multiple stages, from young children to adulthood? Having a work-family balance, and of course, divorce and recovery, and then having blended families. And then, of course, career and finances, the seventh one, financial stewardship and managing debt, men's
Man,
identity beyond work, you know, retirement planning. And these are ideas that others of you certainly can present on as we go on through the year. But of course, also aging and longevity, end of life wellness, if not for us, for our parents, that we have to address. How do we deal with that? How do we deal with men's health after 50? How do we cope with physical decline and preparing spiritually and practically for later life? How do we mentor through the process of aging and leave a legacy, build a legacy in the process? And of course, brotherhood and community, which I think Friends Talking is the antidote for a lot of us, building authentic male friendships, which, to be honest with you, the best example that I've seen anywhere is Friends Talking. Accountability within these groups, having men who hold you accountable, men who are able to have open and honest conversation, men who are good mentors and role models, men who are able to mentor us into being humble,
mhm,
overcoming pride and isolation, and being
mhm,
involved in church without getting burnt out.
mhm,
Really important one. Very important pillar that I hold very dear and thank Friends Talking for. But of course, then public health and faith integration, which is the one that I'm going to spend time talking about. Vaccination and preventative care, trusting in medical science while honoring our faith, uh, health misinformation and discernment. How do we balance that? And how do we contribute to global health and education as Seventh-day Adventists? So I thought I would just give you an overview of some of the areas that we could go into. And I think there's a lot there over the year that we can actually go into. So what's the state of public health today? As we look, for those who live in the United States, you'll know that we continue to have measles outbreak over 2025. To now, we've had several outbreaks of measles. Over 2,000 people have been infected this year across the United States, last year into this year. This year started out with a bang where that is concerned, but also we're in flu season. Um, uh, According to the CDC, we are in a moderately severe flu season. It's estimated over 11 million people have been affected so far. And what we do know in the midst of this is that when we look at affordability of healthcare, one of the big discussions in the United States today is healthcare costs. And we see that it disproportionately, health insurance costs prevent people of color, Black, Hispanic individuals, most affected from getting the type of healthcare coverage that they need. And so when you look at the people who are saying it is very or somewhat difficult to get healthcare, the uninsured, of course, 83% of them saying this, but you go back and you look at African Americans, Hispanic, 40 something to 50 something percent of them. People who are saying that they're having trouble getting healthcare. And when you look on top of that, of course, you have uh, cuts to the vaccination schedule. I'm going to spend a little bit of time talking about that in the context of healthcare. And then you look at the leading causes of death in the United States. Heart disease continue to lead. Um, uh, uh, Alzheimer's disease and dementia comes after that. And this, of course, this statistic was from 2021, so COVID was prominent then. But of course, stroke, um, lung disease, lung cancer, kidney disease, hypertension, breast cancer follow that, and then of course drug abuse as well. And the ones that affect men the most, of course, are heart disease, Alzheimer's disease in that order, stroke, and others come down the line. When we look at the Caribbean, the state of public health in the Caribbean is also problematic. And when we look at non-communicable diseases, non-infectious type diseases. They account for 75% of all deaths in the Caribbean. Barbados alone loses approximately US $75 million annually due to a decreased workforce and work efficiency because of these diseases. The economic impact is significant on these countries because of this issue. And so we see that there's a rising prevalence of disease in these areas. Right after Hurricane Melissa in Jamaica, we saw an outbreak of leptospirosis, significant disease that can leave significant disease burden. I went to the Pan American Health Organization site, and they just put out a report yesterday highlighting the significance of this year's influenza and RSV issue.
Don't drop the plate.
If you could mute your phones, that would be good.
Oh, okay.
Yeah, thank you. And so, you're seeing there a significant issue with flu and RSV already in this season. We're at a pretty high level, and the Caribbean and the Pan American region are not exempt. So this alert is really saying that what we're seeing the possibility of an early or more intense activity of respiratory viruses during this season, which started October, compared to previous years. And so they're saying that in this context, PAHO, along with the WHO, World Health Organization, is recommending that all these member states, which means everybody in the Caribbean and Latin America, should remain vigilant in order to adjust their health services preparedness, because there is a possibility that if you don't prepare for it, with the combination of RSV and influenza, it could overrun and overload your healthcare system. We haven't factored in COVID because it's remained low. But if we should have another uptick in that in flu season, it would be significant. So let's look a little bit at what we're seeing. That red bar that you're seeing is the level of COVID that we're seeing now. Of influenza that we're seeing, 8.25%. Remember that 3% is pandemic epidemic levels. So it's way above that. And 93% of what we're seeing is an influenza A strain called H3N2. Not unusual. This flu strain has been around. It's a part of the vaccine that we have, the trivalent or quadrivalent vaccine that's available. However, there is a new subclade. In other words, there's a mutant of this influenza virus that we're seeing called subclade K that actually started to come on the scene at the end of last spring into last summer in Europe. And it's accounting for 91.5% of all the influenza strains that we're seeing around. And that's why you're seeing here that the CDC estimates that there have been at least 15 million illnesses that have been reported, over 180,000 hospitalizations and over 7,400 deaths from the flu so far in this season in the United States. And you can see this level. All the other gray and black lines are previous seasons. So you can see that we're on an exponential climb here. And so we saw at the hospital that's close to us, one of our elders was telling me today that they have declared a mask for everybody going into that hospital. They do that only when the levels are so very high coming in. Today, we made an announcement in our church that, people should stay home if they're sick. I washed my hands 3 to 4 times at church after shaking hands. People started doing fist bumps. And it would be my advice now, especially for people who are more vulnerable. If you have underlying illnesses, you want to be very, very careful right now, because this influenza strain will knock you down. And if you haven't had the flu vaccine is not exactly matched to it, because of course the flu vaccine was made before we saw this subclade K take over. However, there is a vaccine that covers H3N2, and it does give you 30-something to 40-something% protection against hospitalization from this subclade K. So it's not nothing. However, it's not going to prevent you from getting illnesses overall. What we're seeing, looking at outpatient illnesses, these are people who are showing up, they're not being admitted, but you can see there that kids from 0 to 4 year olds are most affected in terms of outpatient cases, followed by 5 to 24 year olds, followed by your 25-year-olds. But when you look overall at those who are actually getting hospitalized, it's 65 plus. They're getting hospitalized at a much higher rate than the kids. When we look at regions, if you're in the United States, we can see that literally every region is on an exponential climb now, although the South and the Northeast seems to be climbing faster. Nationally, we're seeing in the blue line there that you're seeing is a national trend. And so this is the way the United States look today. The darker colors there, the purple, the brown, are the very highs, and you can see that we're seeing multiple states with those purples and darker colors. So we're in the midst of flu season right now, and it's continuing to climb. And so that is why it's really important now that we talk about the widespread problem of misinformation, especially health misinformation, that we continue to experience. And in fact, a lot of people haven't taken the flu vaccine this season. One of the reasons you're having so many hospitalizations because of the amount of misinformation that's out there, because of what people have been saying. People have been afraid to take their vaccine and to be protected. Because you have this misinformation campaign out there. And people seem not to have a great way of counteracting that, to the extent that the WHO put out this tips for navigating the infodemic, they call it. And the first thing they're saying is, what is the source of the information that you're getting? And advising people to go beyond the headlines and identify who's writing this. What's the date that it's coming out? Examining the supporting evidence. Is this built in science, or is this just people's opinion? And then, of course, check your own biases. Are you drawn to this because of what you previously believed, or because there's really good facts there? So that brings me to what I really want to share with you, this discern framework. And discern is an acronym for define the claim, investigate, separate facts from values, consider the context and risk, engage, and engage with humility, not with dogmatic stance, responding responsibly to what you see. Should you share this or not? And then at the very end, note the consequences. Ask the question, what happens if I'm wrong about this and I share it? How many people will be affected? And so when we think about this, I think this discern framework works well for Seventh-day Adventist men, because I think it aligns with our health philosophy, the philosophy of prevention, using evidence for that prevention, and having balance in our healthcare. And this is what discern is really asking us to do. In defining the claim and investigating the source of it and separating the facts, considering the risk. I think what that does for us is that it causes us to prevent sharing something that might be harmful to somebody. And it's important in this context because while it's respecting the liberty of conscience, it's not endorsing misinformation. And it helps us to lead our families and the church through these polarizing times that we find ourselves in, avoiding, the binaries that people try to force us into, faith or science, as if there's no reason why they couldn't go together. And at the same time, building credibility with our community. So I think discern will help us to move from reaction to reflection, so that our health decisions, our personal health decisions, as well as the health decisions that we're making for others, is actually informed to a great extent by evidence overall. So I hope to share a few slides of this with you to go through this. So let's define some of these more clearly with discern. Again, the D is for defining the claim. Clarify what exactly is being asserted. What exactly is this claim getting at? And this is not necessarily the headline. What is the precise claim? Because many times these false claims have really flashy headlines. Uh, but what is it really saying? Then ask yourself, is this about safety of the intervention, for example, the vaccine? Is it about effectiveness? Is it about politics? Is it about ethics? And how could I disprove this claim? What evidences could I look up that would disprove this claim, and where do I go for it? Which brings us to the next one. Because the thing is, responding to vague or exaggerated summaries rather than actual statement can be a problem, you know, and people get drawn into a rabbit hole of going down this trek many times. And so after you've defined exactly what it is that you're looking for, then you investigate. What exactly is it claiming? Okay, let me investigate to see if this is credible or not. And the questions to ask yourself there is, who's making the claim? Do they have the credentials or expertise to make the claim that they're making? Not some picture of somebody in a lab coat or some video of somebody in a lab coat making a medical claim without really saying who they are and without any peer-reviewed substance and expertise behind their claims. Are they citing primary sources? In other words, did you go right back to where that research was actually done? Or are you looking at somebody's interpretation of what those results are? Do they have financial, political, or ideological incentives? And what we see over and over and over again is that many times the people who are the loudest in verbalizing these claims are actually benefiting significantly financially from these. And now we've seen a conflation of politics and ideology with medical misinformation, which makes it even worse. And from a Seventh-day Adventist perspective, we have to be careful that because somebody quotes something that we're familiar with, because somebody, for example, pulls something out of a health narrative from Ellen White, that we don't get mistaken into thinking that it's true because they're attaching something that we know to be credible to it. That investigation part becomes necessary. So define, investigate, and then you have to separate facts from values. Why is that important? We have to differentiate evidence, distinguish evidence from our moral or theological judgment. Because sometimes our moral or theological judgments are not enough to tell us if a piece of health information is true or not. What are the best available evidence, and what does that show? And we should know the difference between that and what ethical, spiritual, or liberty concerns might be involved. There might be a piece of scientific information that is true, but is not being used in the right way. Say it goes against our values and our spiritual stance. We have to know what that is so that we can redefine what is there. Are Bible texts being used to support facts or values? That's important. Disagreement many times often arise, in my experience at least, from values and not facts. A lot of times we disagree about people's values and not the facts, and sometimes the facts is where the medical information lie. So it feels like it's at odds to us, but it really isn't. And then the C is consider the context. Who is affected? Is this affecting children? Because the risk here is sometimes we try to put it in a one-size-fits-all kind of bucket. It doesn't work. Is it affecting individuals versus community? Is it short-term or long-term? What happens if the claim is wrong? We have to consider the risk and the context within which this is being spoken. And for Seventh-day Adventists, in terms of the side that we want to stand on, preventative thinking and care for the vulnerable has to be a part of our evaluation and our consideration. And then, of course, the E in discern, to engage with humility. A lot of times we find ourselves in intellectual type of discussions with people and we forget to be humble. Am I willing to revise my view if better evidence presents itself. And it's one of the most challenging things I've seen, even among our Christian brothers and sisters, that people are not willing to change their minds, even in the face of overwhelming evidence. Am I treating disagreements as moral failure? Am I thinking that if I admit that I was wrong, people are going to see this as a moral failure? Really, really important for us to not allow that to prevent us from doing the right thing. And then, of course, do I speak with curiosity or contempt? You know, how am I approaching this situation? Check ourselves spiritually, because knowledge without humility damages our witness. Some of the very people we get into a spat with, we might need to bring the gospel to, and that might affect how we go about doing that. And then, of course, the R in discern, responding in a responsible manner. How do we respond in these situations? Avoid forwarding unverified claims. You know, when I get something on WhatsApp or Facebook, I don't automatically share it. I check this out. And if I don't have the time right away to check it out, I wait until I get the time to check it out before I share it. So you're not going to see me forwarding something that I haven't at least made an attempt to verify. And then who are you sending it to? Encouraging professional consultation when appropriate. Do you have a friend or an acquaintance or somebody else who you know could give you the correct information and give you the right analysis on it? You know, have a conscience in the process, knowing that you could possibly affect somebody negatively. And look through a leadership lens. You know, what impact will my words have on others' health, trust, and faith? Many times we have way more influence than we think we do. And you saying something will absolutely influence somebody in the way they think and act on a piece of information. And then, you know, note the consequences. What happens if I'm wrong? Who could be harmed if this claim is false? What are the downstream effects on vulnerable people, on the church and its doctrine and unity, on my public witness? Is this a reversible decision or a high stakes one? These are important considerations. And so as we look through this, Scripture actually provides us with some guidance. You know, the biblical framework, where it tells us that wisdom, stewardship, and love of neighbor should guide our health decisions. Faith should inform discernment and not denial of evidence. And so as we look through this, one of the things that we want to be certain of is that we're looking at a biblical framework. And the biblical framework, although the Bible does not prescribe modern medical protocols, it consistently tells us that we should love our neighbor. It consistently tells us that we should be thoughtful in terms of stewardship of our bodies and the influence that we have. It consistently encourages us to have wisdom and counsel, to be truthful and to be restrained in our speech, to care for the vulnerable. And I think these principles directly support thoughtful public health principles. So here is a case study. You know, a member forwards a headline claiming many routine childhood vaccines are no longer recommended, right? Because they've seen what our HHS secretary has put out. What you have as a result is that parents are confused and some want to stop routine vaccination or immunizations immediately or entirely. The question now is, how do we approach this? There's some tensions here, right? You have policy, process of policy there versus scientific evidence. And the question you have to ask is, who changed what and how? In this current situation that we find ourselves, because this is a real scenario, you have a confusion between what is not universally recommended versus safe and effectiveness. The fact that somebody has said this is no longer universally recommended doesn't mean that this vaccine is unsafe. And what this does now is that you have a fracture of trust among parents and clinicians and church leadership. And if you're not careful, it can cascade into dividing people at a time when you can't afford for that to happen. So how do we go about navigating these treacherous landscapes in our discussions? And so the question now that we have to ask ourselves is, what do we know versus what we're assuming based on the headlines? Who has the ability to dig through this and give us important information? And what sources should define the facts rather than just speculating? How can a church communicate without becoming partisan? How do we go about this without getting into the politics? And what I teach people to do is not to forward until verified, as we said before. Maybe in a church setting, consider a neutral question and answer night with a pediatrician or somebody else in pediatric infectious diseases who can actually give the facts. Because this is real scenario is playing out because we have a directive from the Trump administration to overhaul these long-standing, decades-old vaccine recommendations to align with that of other countries, more specifically Denmark. And I could go deep into this. I'm not going to get sidetracked, however, into going too deep into this. But it's important to see what is it that these new recommendations, for those of you who are in the United States, this is what the new recommendations are. That the MMR, polio, chickenpox, DTaP, Tdap, Hib, or PCV, HPV, and vaccines are still routinely recommended for children. However, RSV, that's a respiratory syncytial virus, hepatitis A and B, the meningococcal pneumonia vaccine, those are not recommended routinely anymore. They're saying these should only be given to children who have parents who are in high-risk groups. And we can talk at length about how do you define that? How will we know who's in the high-risk group? Because, of course, we've tried that before. Tried that with hepatitis B, and it did not reduce the cases of hepatitis B. And the thing you should know about hepatitis B, for example, is that for a child who gets hepatitis B within the first 30 days of birth, which you can get very easily from an infected family member who doesn't know that they're carrying it, hepatitis B can sit around on a surface for a very long time and still be viable. Not hours, but days. It can sit around and still be viable, which means that you could easily get infected with just a scratch or a cut or something else like that. How do you know who should get it and who shouldn't? Dengue is not routinely recommended anymore, only for high-risk groups. RSV is a virus that sends kids to the hospital more than anything else. More kids end up in the hospital each year from RSV than any other respiratory infection. And that is why it was so important to get this monoclonal antibody for kids who are younger and get a vaccine for moms who are pregnant, and to get kids vaccinated so that they're protected. And of course, things like influenza and COVID and rotavirus, these are no longer recommended for children. And so we're told then we've gone from 18 routinely recommended vaccines for children in the United States to 11. And of course, we say that Denmark is who we're patterning it off, which when you really think about it is really silly, because Denmark is a country of like 6 million people, right? Denmark doesn't even have the population of New York City. The other thing that is not being considered is that Denmark has universal health care. In other words, Denmark can take a calculated risk that I'm not going to vaccinate against this thing, because if a kid actually gets infected, they're going to see the doctor in record time. They're never going to have to wait in a crowded emergency room. Any doctor that you go to in Denmark can access your health records from anywhere that you've gone before. They have a fully integrated healthcare system. And again, universal healthcare. In other words, the United States is no Denmark. In fact, the United States falls dead last of the top 10 industrial countries or first world countries in terms of healthcare. So one doesn't make decisions about routine vaccination based on comparison to some other country. Geographically, there are diseases that we have in the United States that Denmark doesn't have. There are vaccines that you have to have if you're in Africa that you wouldn't have to have if you're in the United States. Why? Because geographically, we don't have those diseases. We don't have the vectors. So it strikes me as not a smart thing to look at some other country under a simple false premise. And the false premise is that the numbers of vaccines that are being given are too many. And the question I always ask people is, how do you come to that conclusion? How do you decide on that? Do you know what the immunological repertoire is? And most people have never heard that word. It means how many protein antigens, how many different things can your body handle at any one time? And it might surprise you, it's in the order of 10 to the 19th to 10 to the 20 something. Our vaccine schedule comes not even close because we have less than 300 antigens for all of the vaccines combined. Less than 300. When we have the ability as a body to handle 10 to the 19th to 10 to the 25 or thereabouts. So it's important to note, so I'm using the discern method to look at this in context. The information that I just presented to you, it's important to take it in context and to note some facts that the scientific evidence about vaccines, vaccination, and vaccine safety has not changed. These recommendations are not being modified because new research emerged or new safety risks came about, or some information that the vaccines are not necessary or they're less effective. No new safety concerns have come to light. So these recommendations, this change, this new information is completely based on ideology and political directive, not on scientific rigor. And that is where we run the problem. So when we look at preventative care and vaccination and risk reduction, Proverbs tells us that the prudent see danger and take refuge, but the simple keep going and pay the penalty. In other words, prevention is better than responding to a crisis. If you can prevent a disease, why not prevent that disease rather than trying to treat the person or respond to it once the person has gotten it, when other complications could sit in, causing more problems that you don't have the capacity to handle, right? So very important there. The other thing that the Bible tells us is that through laziness, the rafters sag. Because of idle hands, the house leaks. In other words, responsibility for foreseeable harm. If you foresee that this thing can cause a harm, why not deal with it rather than waiting for it to cause a crisis? And then thirdly, another important thing is that protection of others is important, not just ourselves. Deuteronomy 22:8 says, when you build a new house, you shall make a parapet for your roof, that you may not bring the guilt of blood upon your house. What is it talking about here? You see, in those days when they built houses, their houses looked like this, that the roof was set up so that people could go up there and sit and have conversations, have a party. But you built a parapet. A parapet is a wall around it so that people don't accidentally walk off or fall off of it. That's what it means. You shall build a parapet so that the guilt, the blood is not on your hands. In other words, having protections in place based on evidence is really important rather than waiting for something to happen. So the application is that God expects reasonable safeguards against foreseeable harm. Preventative action is not fair. It's not saying that somebody doesn't have faith because we're saying protect yourself. It is actually wisdom. Ignoring known risks can carry other types of issues with it. So we need to be thoughtful. You know, when in the time of COVID, we saw a lot of polarization because of this. You know, somebody says, oh, the CDC backed off boosters, so COVID shots never really worked. Another replies, if you don't boost, you don't care about others. And this now starts an argument, starts polarization, it starts people in a course. where they get into issues and problems, which need not be. So the tension is between guidance in an endemic phase versus, are you flip-flopping? In other words, the fact that somebody's not recommending this, does that mean that it never worked? The risk benefit by age, for example, if you're older with underlying conditions, you probably don't have the luxury of not getting a booster, while somebody who might be younger and can endure an infection might be able to. So the questions that you want to ask yourself in these scenarios, what does shared decision making mean on the ground? In my opinion, shared decision making has always happened, where if a parent shows up to their pediatrician and says, I don't want to vaccinate my kid, you're going to have a conversation about that. So that's shared decision making. But in the case where there's clear evidence that there's harm if something is not done, shared decision making should come from the expert advice and not necessarily having somebody who is not an expert saying, hey, I just don't feel like it, so it shouldn't be done. So we need to really be thoughtful in these spaces. And then, of course, faith and medical science are not enemies. A lot of this has been presented in this way recently, that there's a dichotomy between, our faith and medical advice. A lot of my good friends are Seventh-day Adventist doctors. And, they're thoughtful, caring, honest people who believe in the power of God to save. So in this regard, Proverbs 11:14 has some really important information for us. It said, where there's no counsel, the people fall. But in the multitude of counselors, there is what? There's safety. God worked through the skills of human beings. We see in Proverbs 18:15 that the heart of the prudent acquires knowledge and the ear of the wise seeks knowledge. So seeking help is not a lack of faith. And then we see in Colossians 4:14 that Luke, the beloved physician, greets you. Luke was a doctor. This is a divine gift. So scripture affirms the work of skilled professionals in this space. And faith shapes how we decide, not whether evidence matters. And this overall, I think, in my opinion at least, rejects this false dichotomy between God versus medicine, or science. God is a God of science. Where the measles outbreak is concerned, you saw the resurgence of measles. Measles was declared eradicated in the United States in 2000. Now we've had the largest measles outbreak we've had in decades because so many people have chosen not to vaccinate. And among them are some prominent Seventh-day Adventists. And the question is, what is our responsibility to these vulnerable children? Should a church school, for example, accept students with incomplete immunizations, especially when you're having outbreaks all around? And the tension that brings is the tension between individual liberty versus our duty to care in congregate settings. So you might say, oh, my kid is strong and healthy. But what about the kid who is not that strong and healthy because they have some underlying immunodeficiency that cause problems? Infants can't get vaccinated against measles. What about their protection? And so what is the least harm approach for a school or program? And what is our role as Seventh-day Adventist men in leading that discussion when we see it happening in our communities, in our schools? What voices should inform policy? Should a pastor do the responsible thing and bring in medical experts rather than making a decision versus a moral or personal opinion? What options exist outside of just accepting or rejecting? And so, when we think about how we should go about this, we should separate theological liberty from factual claims many times in order to actually have the discussion and to reach a conclusion. And so discernment and health misinformation needs to be weighed. Truth matters. 1 Thessalonians 5:21 said, test all things, hold fast what is good, You know, not every confident voice is trustworthy. Proverbs 14 tells us the simple believes every word, but the prudent considers well his steps. And as we said in discern, we have to investigate and test the claims. Beware of false prophets, Matthew tells us. You will know them by their fruits. So when we think about it, the application here is that discernment is what is commandment, is what is being commanded here. It's not optional. Sharing unverified claims can cause real harm, as we said before. And sincerity does not equal to truth. You might be sincere, but sincerely wrong. And that can cause problems. And I'll skip over that because I want to share with you a few things. We see, for example, some interesting trends in the literature where medical conspiracy is concerned. This graph, this chart here is an interesting one. It was published in the Journal of American Medical Association Internal Medicine in 2014. And what the figure shows is that people who regularly engage in misinformation, who believe falsehoods about pesticides, about GMOs or chemicals, the chemophobia, or toxins, they also reject vaccines and seek unproven treatments for all hosts of things, including cancer. They refuse evidence-based health behavior. And so as you can see here, the more of these things they believe is the less likely they are to get annual physicals, is the less likely they are to get their flu shot, it's the less likely they are to wear sunscreen, it's the less likely they are to visit the dentist. And these individuals are more likely to take herbal supplements, to go for organic foods, which I'm going to spend some time talking about, and go to farm stands when they can. I mean, there's nothing wrong with going to a farm stand, but you should know what you're buying. The fact that something has an organic label doesn't mean that it is safe, right? And so you might see this publication, I'm not sure how many of you see it, from the Environmental Working Group. Sounds legitimate, doesn't it? And they publish what is called a Dirty Dozen, list of fruits and vegetables and other things that they tell you not to buy because they're laced with chemicals and how they're unsafe and unfit for you. And last year's Dirty Dozen list, number 1 was spinach. Number 2 was strawberries. You have grapes and peaches and cherries on it. And they're telling you, don't eat these things because they can cause harm. And somebody who I look up to, Andrea Love, who is a great epidemiologist, typically takes this on, this dubious Dirty Dozen. And I want you to see that none of the produce items that are included in this list have pesticide levels that rise to anything that the EPA or others are concerned about. They do not exceed any safety thresholds. If they did, they would not be on the shelf. There are established safety levels for every single chemical. And the thing you have to realize is the fact that something has chemicals on it doesn't mean that it's unsafe. Why? Most of the most dangerous chemicals we know come from natural products. You eat an apple, the seed of the apple has arsenic in it, right? A lot of fruits and plants produce chemicals to ward off pests. And so it's not about whether or not a chemical is present, it's about how much of it is present. Because it's not the presence of a chemical that often cause harm. It's the amount of it that can cause harm. And that's really, really important. And so the Environmental Working Group actually make profit off doing this. You're like, why would somebody publish something like this? They brought in $18.1 million in 2023 that they use for their political lobbying. And where do they get this money? They get this money from these groups of people. Who are these group of people? These are people who push organic farming. And you see these brands, you can see them in your supermarket, right? Huge donations to the very group making this publication, right? One of the tricks that you have to use, one of the tenets that you have to use to discern misinformation is, where is it coming from? Who's benefiting from it? And certainly these people are benefiting. So let's just look a little bit at pesticides and herbicides and stuff. You know, why can't we just get rid of them in farming, in regular farming? Because organic farming tell you we don't use any synthetic pesticides and we don't use any synthetic herbicides. What they don't tell you is that they still have to use these pesticides and herbicides. They're just not synthetic. So if we did not utilize these pesticides for agriculture, the yields would be so low, the crops would be significantly impacted, and most of us couldn't buy any of the products out there because there are a lot of people to feed, right? And so here are some facts. Herbicides are necessary because they protect the soil and they prevent you from having to go in and till the soil, which reduce erosion of the soil and lots of other things that come from it. Pest control, it is estimated, through the Department of Agriculture actually saves $40 billion in crop losses every year. And without these pest controls, farmers would lose a significant amount of their crops annually, which would make all of it more expensive. And a stable food supply is necessary because of a growing population. On the flip side here, and that's important for my last bullet point there, organic farming used 84% more land for the same yield, which means that they're not protecting the environment. And they yield 55% lower by area of conventional farming. So essentially, every chemical, as I said, can be harmful. It's just a matter of dose. And so organic farming, here are the facts. Here are the facts for your organic farming. Organic farming still use fungicides. And fungicides are necessary because they control molds and mildew. These are fungal pathogens that are very, very significant on your plant. And look at the amount of the organic copper sulfate that needs to be used. You see the difference there? Over 300 milligrams per kilogram of that they have to use. With the lethal dose here, the LD50 is 300, but they have to use 1 to 4 pounds per acre, right? The LD50 for copper hydroxide, which again, organic farming use, the LD350 is 1,000. LD50, which means that this is the lethal dose. LD50 is 2,000 milligrams per kilogram here of elemental sulfur. And look at what they use, 3 to 10 pounds per acre, right? Total applied per season, 48 to 160 pounds per acre. But you compare that now with the synthetic ones that are used for conventional farming to substitute for these organic ones, and you use way less of it, way less. And we know that their safety has been proven over decades and decades. And yet, organic farms will tell you that what they're using is better. You can know. Look at the LD50, look at how much they have to use. In other words, your organic substances that you're buying in most supermarkets have way more chemicals than the conventional one. It's just that they don't have to report on it. It's organic only because the herbicides and the fungicides and the pesticides that they're using are not man-made. They're not man-modified. The man-made ones are made so that you can use less of it. And of course, they have to meet very high standards. The organic ones have no standards because they're not regulated. And so I just thought it was important that you know this. So here are some facts. Organic is not the healthy choice. It is the agricultural arm of the wellness industrial complex. And this is Andrea Love speaking. If you care about public health, sustainability, food security, or scientific integrity, you would reject the organic ideology outright. What they sell have no greater nutrients. They don't taste better. They don't protect land anymore. Wellness-based agriculture is no more acceptable than wellness-based oncology or immunology, which says, oh, you don't have to take your chemotherapy. You can take whatever else you want to take as an alternative, not as an additive, but as an alternative. So science is not something you get to apply in healthcare and abandon in the grocery store. You either believe in science or you don't. Why? Because again, Thessalonians said, test all things, hold fast what is good. The wise man says, The simple believes everything, but the prudent considers well his steps. Christians are accountable for truth. They're accountable for the information that we put out there. So words, influence, and responsibility is important. The power of the tongue is important. Death and life are in the power of the tongue, and those who love it will eat its fruit. And teachers will be judged, James says. My brethren, let not many of you become teachers, knowing that we shall receive a stricter judgment. Those of us who go out there and are teaching people things, we have to make sure it's true. And as I wrap up, care for the vulnerable, which is public health. Romans 15:1, Paul says, we then who are strong ought to bear with the scruples of the weak and not to please ourselves. In Philippians, it goes on to say, let each of you look out not only for his own interests, but also for the interests of others. So I'll end with liberty, that not all things are helpful. 1 Corinthians chapter 10:23 say, all things are lawful but for me, but not all things are helpful. All things are lawful for me, but not all things edify. Let no one seek his own, but each one the other's well-being. Galatians 5:13, for you, brethren, have been called to liberty. Only do not use liberty as an opportunity for the flesh, but through love serve one another. Because liberty comes with responsibility. But beware lest somehow this liberty of yours, 1 Corinthians 8:9 says, become a stumbling block to those who are weak. So as we look at health and the gospel and the witness, Jesus healed diseases wherever he went. In Matthew, we see that. Jesus went about all the cities and villages, teaching in their synagogues, preaching the gospel of the kingdom, and healing every sickness and every disease. Isaiah 58, one of my favorite passages says, is not this the fast that I have chosen, to loose the bonds of wickedness, to undo the heavy burdens, to let the oppressed go free, and that you break every yoke? Is it not to share your bread with the hungry, and that you bring to your house the poor who are cast out? When you see the naked, that you cover him and not hide yourself from your own flesh? Then your light shall break forth like the morning. Your healing shall spring forth speedily, and your righteousness shall go before you. The glory of the Lord shall be your rear guard. Health ministry actually strengthens mission. Wisdom over fear is what is important in these times. And I'll stop there, and we can have some discussion if we have time. So I'm seeing some questions in the chat. Even though a vaccine is not recommended, can I ask my doctor to administer it to me? Absolutely. This is what they're calling shared decision making. So a vaccine might not be recommended. The challenge here is if a vaccine is not recommended, an insurance company could choose not to pay for it. Even though they're saying that that's going to be a safeguard in place where that is not going to happen, we don't know. The other thing is when things are not recommended as a vaccine, it falls through the cracks. Parents don't ask about it. Parents don't necessarily want to do it because they feel that something must be wrong why it's not recommended, but you certainly can ask. How about vaccines for the elderly? How do the new rules affect those vaccine schedules? It affects the COVID vaccines because the COVID vaccines are not being routinely recommended anymore for a whole host of people. And so, the elderly, of course, if you have underlying conditions, you need your flu shot, you need your COVID shot, you need other vaccines for shingles and other things that you need to get. And certainly you want to have a conversation with your healthcare provider about that. This current state of health affairs as labeled science and intellectuals' knowledge as the enemy. The administrative strategy is to bring confusion. Certainly true. Definitely true. And chaos. The strategy is extremely difficult. Let me just pull this out so I can read this better. To contain or prevent, how can one family or person make a difference? Really, really important question there, Dr. Holness. You know, how do we make a difference in the current state? And what I typically say, have patience and continue to have your one-on-one conversations with people. For me, that is important. Continue to have those one-on-one conversations with individuals. Even if it feels like you're not getting anywhere. I proved this over COVID, where there are people who I interacted with for a whole year before they're finally willing to listen and have a real conversation. Sometimes people have to build trust in us as individuals. And for people in healthcare, you just have to continue to share the truth and the facts with people and find good ways of sharing that, of showing them that, hey, here's facts. Here's the science versus ideology, without trying to wade into the politics. But it's a difficult thing. It's a difficult thing. What is the SDA stance on childhood and adult vaccinations? Reminds what our stance was on COVID. You know, it would be interesting whether Advent Health or Loma Linda make adjustments with the new vaccine changes, and what kind of adjustments with respect to student acceptance will our Adventist education institutions make in the near future. Typically, the Adventist health system typically go with what the American Medical Association, the American Association of Pediatrics, and other health organizations go with. I haven't seen any announcements from our SDA leadership, but I would be surprised if they would go against what these long-standing health organizations provide and recommend. And so a lot of doctors are now going with what these professional organizations are saying. Yeah, that is true. The EWG looks like Ellen White, but it's not Ellen G. White. This is a different EWG. This EWG, the so-called Environmental Working Group, is just a false organization that work essentially to benefit the organic farming industry, which is a massive industry. And when you look at who the people are who own this stuff, then you begin to understand why it is that they push these narratives, and you see where the money is going, and it makes total sense.
Okay, doctor, are you able to hear me now?
Yes, I'm hearing you now.
Okay, good. Thank you very much for your presentation. And I wanted to open the floor. I've been trying to open the floor for the questions. But one of the things that I as a lay person that you touched on is, and maybe you can address it, is the reticence, especially of Adventists, for vaccine. We tend to question vaccines and their validity quite a lot. And as I've said on numerous occasions on this program, I know of many Adventists who have died because of their resistance to taking medical counsel, for example, on cancer, their resistance to taking chemotherapy, and their belief that, hey, God will heal and God will restore. And so therefore, I don't need to take chemotherapy or radiation therapy. And in many cases, they have died. How do we reverse that, or use education to enlighten our people as to the importance of medical knowledge and the extent to which medical advances have been made in medical knowledge nowadays?
Yeah, really important question. I've had those interactions and see those sad situations as well, Marcel. And sometimes I think that people just misinterpret our health message and misread the Bible, because as I showed you in multiple texts there, Proverbs 23, where it tells you that, you really should be prudent in seeing and avoiding danger. You know, do you walk out in a busy street and not look both ways because God is going to protect you? And if a car hits you and you die, that's the will of God? Nobody does that, right? Why would you do the same thing with your health? The fact is that a lot of people seem to be making the argument that God created me with a robust immune system. Why do I need to take a vaccine? And what I always say to people is, you seem to have read up to Genesis chapter 1, but you didn't read further. Because after Genesis chapter 1, man actually sinned. Yes, God created man perfect, but man sinned. And because man sinned, there's been a constant deterioration in what God created. We didn't just deteriorate in stature and start living for shorter periods of time. Our immune systems also have been significantly compromised. And even with that, we still have robust immune systems, but they don't protect us against everything that comes our way. As a result of that, vaccines become necessary. Vaccines, like every other thing that have come in medical knowledge, have their downsides and they have their pluses and their minuses. They're medications. So like every other medication, you're going to have warnings on your vaccines for certain groups of people based on what the testing shows. But essentially, all that vaccines are just a way to educate your immune system to say, if you see this thing again, don't play nice with it because it is out to get you. And I don't know that there's a simple one-size-fits-all method of conveying this to people who have come to the conclusion that somehow their natural, in quotes, immune system is going to protect them against deadly diseases that keep popping up over and over again. Unfortunately, many people find out the hard way. I think we just need to educate our people. And as I said in my presentation, we have to be humble. We have to be teachable. I'm the type of person who think I can teach any student, because for me, by definition, a student is somebody who wants to learn. I certainly cannot teach somebody who thinks they know everything and they're not willing to open their minds and listen and have a discussion.
Doc, I have a question.
Yes, Pastor.
In light of what's coming out of the Department of Health on some of our long-standing conventions regarding health, how should we really relate to these new information, because it seems contradictory and confusing?
Pastor, you are right that it is contradictory and confusing. And the reason why it's contradictory and confusing is that these decisions are not being made based on science or medical information. And that is the important thing. That is the approach that you have to take. You have to realize that the scientific evidence has not changed. No scientific evidence has changed since January or February of last year. What has changed is that we now have people like RFK Jr., who is directing and has authority to change health advice, but has no medical knowledge and has always had these conspiratorial beliefs and ideologies about vaccines. And now he's in a position to act on that belief. And essentially what he's doing now in dismantling and bringing questions to vaccines, he's dismantling a system that is in place to protect vaccine makers. What he's going after now is to pull this thing in a direction where vaccine manufacturers have no protection from lawsuits. Because you see, before, you could go and, before these laws were put in place, you could go and sue, individuals could sue a vaccine company if they thought that they had a vaccine injury. Now what the policy is that the vaccine companies pay certain amounts of money into a fund for vaccine injury, and people who have legitimate injuries from vaccines can actually go and present their case. It'll be evaluated by a panel, and they would get paid or get a recompense from that fund. RFK has long worked as a lawyer suing vaccine for vaccine injury and want those protections removed because he made millions of that and expect to make even more after he leaves this position. So there's a systematic dismantling of protections. But more than that, I think he fundamentally believes that vaccines are bad. I don't know if he started out that way or over time he has just convinced himself of this, but he fundamentally believes that vaccines are bad for you and nobody should get them. And no matter what he says, this is what he believes and this is what he's acting on. He's surrounded himself with the people who worked with him and for him in pushing these conspiracies and these lies. None of them are scientists of any caliber. None of them are medical professionals of any repute. But now they have the power to make these decisions. And so as a layperson, as a clinician, as a physician, you now have to look and say, where do I get my medical information? You have to get your medical information from your physician and not from something that's posted on the HHS website. The truth is that there's a lot now from the CDC website that you can't believe, unfortunately. And so you have to get your information from places like CIDRAP and other areas that are legitimate spaces. States now have come together to make regional advice centers, like for the Northeast region and the Western region, with California and these other states getting together. And that's how they're advising their doctors. And states are the final arbiters of what vaccines are routinely given in their states. The federal government helps to pay for it through insurance coverage and managing it. But states are the ones who administer it. And the states have not shown much interest in changing to these new recommendations.
Thank you. All I can say is that America is in trouble. Big trouble.
That's an understatement. Along these lines, I think it's a very dangerous time that we're in. And I have absolutely no doubt that people will suffer and will die because of these new policies. There's no doubt about it. Wilbert.
Yeah, Dr. Webley, so good to have you all the time, anytime.
Thank you, sir.
Yeah. Now, the insurance companies do not respond as much to scientific evidence as much as they respond to federal guidelines. So, I mean, what do we do here? Your insurance company says, I'm not covering this because the federal government does not require me to cover this. And so we have this tug of war between the scientific community and the federal government.
Yes.
What does the consumer ultimately do?
The truth is, in anytime you have that sort of tug of war, the consumer is the loser, right? The consumer will suffer in those situations. So far, insurance companies have not said that they will not cover these things, because I think the insurance companies themselves realize that these type of preventative measures are inherently safe. And here's the thing, the insurance companies will have to look and ask themselves some important questions. And those questions are going to be, am I going to pay for this vaccine upfront for preventative care? Because insurance companies are very much invested in preventative care. Or am I going to allow this person to get sick and then pay 100 times that while they're in the hospital for coverage, and they might not even recover, right? This is the calculation that I think insurance companies will have to make. And I think a lot of them at this stage have not changed their policies. They have not changed their stance, because I think they realize that in the end, they might end up paying more for it. So I'm looking very closely at this to see what insurance companies will do. But to date, insurance companies have continued to say that they will cover these vaccines and these types of care.
Thank you. Thank you.
Yeah. Ken?
Hey, good, very excellent lecture, Dr. Webley. I was just thinking while you're doing your lecture, the first few slides you showed spoke about one of the things I did on my lectures is the morbidity and mortality, the top 10 morbidity and mortality things that cause death in America. And you mentioned a good fact. I think a few years ago, the United States was ranked, I think 27 or 29 or 30 when it comes to life expectancy compared to some of the other westernized developed countries. And so when you follow that line of thought, things are going to get worse. So it's not anything different. It's worse now, but it seems like they're still following the same line of thought, is that even though we have all the institutions, medical institutions, the pharmaceuticals, the research, when it comes to life expectancy, and you look at health disparities, and now you look at some of the changes in the laws, it's not any different than what we've seen over the past 10, 15, 20 years, that we are one of the lowest when it comes to life expectancy. And one of the things that affects that is just what you mentioned about the universal insurance that other countries have that really help everyone in the country. So it's in line. It's just going to get worse, and just the current administration will worsen it, and millions of lives will be affected.
Absolutely, I agree. One of the big issues here, Dr. Holness, and you would know this well, is that the people making these decisions will certainly not be impacted significantly. And the reason for that is that all of them have pretty good health insurance. They have full coverage in their health insurance. The people who are going to be most affected are the people on state insurances, people who are on exchanges, people who are uninsured. Those are the people who are really going to be affected by this, because those impacts are going to be felt literally immediately. If an insurance company decides that they're not going to carry something, these are the individuals who are going to be least likely to pay out of pocket for these things. If an infection causes some other serious illness because they didn't get vaccinated, these are the individuals who are going to be most likely to die, because they won't have the type of care that's going to cover them in a hospital or in a rehab or in a long-term care facility. And so it is pretty cynical, I think, of some of these leaders to make these types of decisions knowing that their wealth will protect them from the harmful effects of the policies that are being put in place. And it's shameful, I would say, to a great extent. But Carrington.
Yes, sir. Good to see you again as usual. Always have you with us. I know that the COVID vaccine conspiracy theorists are probably quite happy because of these recommendations, because they're the ones who assaulted you, assaulted the church, assaulted, not necessarily physically, but verbally, because of certain stances that were taken during the course of the pandemic. With the lack of requirement for COVID vaccines now, how do you think this will portend to outbreaks, future outbreaks, future pandemics, and also the zeal of research companies to look into RNA vaccines, especially since these people are totally against RNA vaccines, and they think that they will ultimately wreak havoc in the community, even though they have no evidence for that. What's your insight into that?
Yeah, I mean, this is a huge blow to what I think has been the most significant research findings that we've had in the 21st century in vaccine manufacturing, which is the mRNA vaccines. It is clear what impact this is having on the COVID vaccine. The misinformation has led to a really significant drop in uptake of COVID vaccines and boosters. over the past couple of years. Fewer and fewer people are taking up COVID vaccines. And what has happened is that the government no longer even report on COVID infections and deaths in the way they used to. So people think that it's gone and there's no issue here. Now, we're lucky in this time because we haven't had a surge in COVID. We haven't had a new variant pop up. But, you know, from the experiences that we've had over COVID, we know it's just a matter of time before a new variant is going to come and pop up. And the question is, what's going to happen when that happens? If we actually have a variant that is very robust, that evades the immune response, and you don't have the manufacturing to stand up an mRNA vaccine, let's say you're going to go after a conventional vaccine, that conventional vaccine is probably going to take you 2 years to make and distribute, while your COVID vaccine, while your mRNA vaccine, you could get that within months. And so I think this will significantly impede the speed at which we make a vaccine. And we're seeing it now. We have this new subclade K of a flu virus that is spreading now. 90-something% of all flu cases is this new clade. Now, if this administration had not pulled the money that Moderna had to make a flu vaccine, it's very likely Moderna could stand up a flu vaccine very quickly to counter this subclade and have a much more robust protection against this what we're seeing in this flu season. That's certainly not going to happen now because there's no other vaccine platform that has the type of capability to get a vaccine manufactured in such short period of time. And so it definitely has long-term, or has the potential to have long-term significant effects. But the pathogen is what's going to have the last say. You know, if we don't have a significant outbreak anytime soon, then people will feel safe, they'll be okay. We will continue to have people who don't take the vaccine dying, but it's not being reported widely, so people won't know. But if you actually have a significant bump in cases, and you have a significant amount of our population, which typically is our most vulnerable, people with underlying conditions, older people, they're going to be more significantly impacted. Hopefully, those people's doctors are convincing them to actually take the vaccine.
Just to follow up there, so are they going to be, will there still be the capability to make the COVID vaccines and other for other subsequent variants that may come, or do you think the manufacturers will cut back on doing those other things also?
Well, I mean, the manufacturers have lost money, right, because of the lack of agreements that they have now. So I think they'll continue to make these vaccines. Other countries are taking up these vaccines as well, even though the misinformation campaign is affecting other regions. But I think there's certainly the innovation in that space where the mRNA vaccine is concerned is not going to happen because you need money for that. And while these companies made a significant amount of money in selling these vaccines, for the R&D, they're going to need federal monies to do that, and that federal money is gone. So in my opinion, what's happening now is that we're kind of just in a waiting pattern, waiting to see what happens. And I think manufacturers are probably looking and saying, okay, what happens if there's a surge? Will there be renewed interest in investing in mRNA vaccines for COVID? Or will people change their minds about it? I don't know. And I think all of us are looking and hoping that nothing big happens for the sake of the most vulnerable in our population.
Thank you.
Certainly. Yes, Len?
Hi, good to see you all again, everyone. I have a comment and then a question. My comment is about something I saw recently. I think it was this week, that the hospital in the U.S. Virgin Islands was overwhelmed with flu cases or RSV. There were so many people who were coming in sick. They put out a bulletin, they asking people not to come to the hospital, to emergency room. They couldn't manage it. And only other cases, other problems would be allowed in the emergency room. So it's overwhelming already some places, and we're unaware of it because you don't hear that information being published in other places. The other comment I had was, I am a person who's switched to organic because of some things I read in Consumer Reports years ago. And I don't have if I'd known, I would have gone and started looking up some of the things to kind of ask you questions about. But that's where I was getting a lot of information about some of the danger of some of the chemicals that were in the food. And I understand that there are organic pesticides too that can be used, but so it's a case of which one is going to be more harmful. That's the way I see it. So is there a way to try to determine that now, or is there a list of some place where we can, or maybe at some point we have you come back and look at both types and go through them a little bit more detailed so that we can make wiser decisions?
Yeah, what I was trying to convey here is not necessarily to get down to the nitty-gritty to say this organic food is better than this conventional specifically. It's really to say that the whole idea of organic is something that is not rooted in science.
Okay.
Because in order to be organic, to have the label organic, all that needs to happen is that they do not use conventional synthetic pesticides or fungicides. That's all it is. It doesn't mean they don't use those things, right? It doesn't mean they don't use pesticides. It doesn't mean they don't use fungicides. In fact, because it's not synthetic, because they can't concentrate it, they have to use more of it, right? So it's not the absence of a pesticide or a fungicide or an insecticide that makes it organic. Far from it, right? And so people have just not asked the question what organic actually means. The other thing you have to realize that because it's labeled organic, what they're putting in it is not regulated. So oftentimes they don't even know how much of that substance is actually on or in the organic foods, or you take their word for it. While for the conventional, they're tested out the wazoo. They're constantly tested to make sure that the amounts of pesticides or other chemicals that they have in are well below the recommended levels by the EPA and other agencies. So for example, the Dirty Dozen list there had spinach out there, right? And it's interesting, you would laugh at this. But in order for your conventional spinach, the pesticides in your spinach to actually cause any health consequence, you would have to be eating over 200 and something pounds of spinach per day for that to accumulate over time. Now ask yourself, who eats 200 pounds of spinach in a sitting for that to have consequences? You see what I'm saying? But people are not putting all of that together. Organic doesn't equal your backyard farm, right?
Okay.
People have that sense in their minds when they see the organic symbol that somebody's growing this in their backyard. No, these are hundreds and thousands of acres of stuff. And when you're mass producing anything, you must put measures in place to prevent pesticides, fungicides, to prevent pests and fungi and other things from destroying your crops. Otherwise, you lose billions of dollars over periods of time. So they have to put something on it. It's just that what they put, they extract from sources that they don't modify any rings in those chemicals to make them more efficient, to make them more easily leave the body. That's what the modifications are on the conventional ones that people have gone into the lab and say, okay, here's a natural pesticide. How can I modify this so I use less of it, so it's more economical, and so that the body gets rid of it more quickly, and so that you don't have a lot of accumulation of it on the product or in the body. That's why they're synthetic. It doesn't mean that somehow they're sitting around. If they were sitting around in the body and the body wasn't able to get rid of them, they wouldn't pass the test to be able to be used in farming, right? And that is why the studies will show you that people who eat organic don't have any better health outcome compared to people who eat stuff that's not labeled organic.
Okay. The only thing I have noticed using the organics, though, to me, they spoil faster. And I am not sure if when you're using some of the other pesticides, delays they're more effective and they delay the product from decaying.
That I don't know. I would have to go look that up.
Okay.
But chemistry is important, right? And people oftentimes, when they think about chemistry, they just have a mind block, so they don't venture into it,
Yeah.
right? So one of the arguments that the HHS secretary has made over his career is that vaccines that contain thimerosal, are dangerous because it has in mercury in it, and people have believed this, and people have used this as a reason not to vaccinate because, as far as they're concerned, it has mercury in there. Well, if you know a little bit of chemistry, you'll realize that no vaccine has mercury in it, right? What the vaccine has, it has a compound that will help to prevent microbes from growing in there. And it has a part of the compound that is used. It has a mercuric ring in there.
Yeah.
But mercury itself is not in the vaccine.
Yeah.
But people don't know this. And so as a result of that, people get away with saying this stuff, and they get away with spreading this type of misinformation. And so that's why I actually had to post something on LinkedIn recently to actually address this overall, because so many people were just getting it wrong. So many people were just getting all mixed up in it, and I had to explain a little bit of the chemistry. You can go there and see the link that I just put in to this post on my LinkedIn page, where I had to draw the chemical rings and show the difference between thimerosal, between mercury and ethyl mercury. Because when you have thimerosal gets broken down into the body. It's a preservative, it's an antimicrobial. When it gets broken down, it doesn't have elemental mercury in it. It becomes ethyl mercury. And ethyl mercury is rapidly metabolized and eliminated from the body. Mercury is not a liquid. It's actually an elemental toxic substance that's metallic. That's mercury. That is the mercury that caused problems. And that mercury, when it's broken down, is broken down to methyl mercury. And that can accumulate in the brain. That can cause problems in the brain. It can accumulate in other organs and tissues of the body. But thimerosal is neither mercury nor methyl mercury. And, if you have somebody who has taken a simple chemistry class, this is very simple to explain to them. They'll look at the structure, they'll look at the side chains and the side rings, and they'll say, yeah, you're right. This is a very different thing. And because of the side chain, it can easily be broken down, taken out by the kidneys, and you get rid of it, versus this thing that is metallic, and it's very hard for you to get rid of it, right? But our HHS secretary has conflated these two things. And as a result of that, he's convinced people that this is a dangerous substance and you can't trust the people who put this in. And even though most vaccines do not contain it anymore, because of these arguments, they still continue to make these assertions. And so it's the same thing with organic. There are people who make a ton of money by making you think that conventional foods are so bad for you that you switch to buying organic, which of course is that much more expensive, depending on what type of food you're buying. And you don't get the benefits from it that you think you're getting in many cases. If you see somebody who grew something in their backyard, that's a very different thing. Where they say, I didn't put any fertilizer in it, I didn't put this in it, I didn't use sprays in it, and stuff like that. That's very different from a massive company that's farming acres and acres and thousands of acres of land to plant a substance where they absolutely have to put pesticides and insecticides on it. And that's what I was trying to bring up.
Okay. I have one more comment.
Sure.
When I first started practicing, thimerosal was included in contact lens solutions as a preservative. So I'm familiar with thimerosal.
Yes.
And I've had people come in with that argument, and I've pointed, I said, no, thimerosal is not the same. It's like mercury-like compound, but it does have a higher rate of reactions from patients, maybe slight redness, immune reaction possibly. Then so they've gotten rid of it even in the contact lens solutions. And I have to point out to them exactly what you said. I said it's no longer in the vaccines, at least not in this country for sure. I don't know about other parts of the world. So when you tell me that you're not taking it because of that, then I think your information is outdated and wrong. And I said, go and check on it. And they'll kind of quiet down a little bit so I agree with you. Thank you.
Yeah, and when you think about it too, and the amount of thimerosal that was in vaccines was so tiny, right? It's the same thing with aluminum. They tell you, oh, well, aluminum in vaccines is an adjuvant. It's so dangerous. But of course, when you really think about it, you have more aluminum in the foods you eat over the course of a week than in any vaccine that you'd ever get. Because people don't realize that, aluminum is so abundant in soil and in almost everything else. And so again, it's and in the same post, I think I discussed aluminum, because again, people who do not understand the information, they just look and they take it at face value. And that is why this discern method of looking at things is so very valuable. And I don't know if you were on at the time when I showed the graph of where we are with influenza, with the flu season, but we're right up there. It's right at 8 point something right now. So this is a very, very significant flu season. And I don't see many places where it looked like it's peaked yet. So I think we still have a ways to go before we're out of the woods.
Yeah, thank you. Thank you.
Thank you very much. And thanks for your insights. It's valuable having that working experience with some of these things in the clinical setting.
Hey, so Doc, I got, all right.
Hey, Paul.
Give me a second. So Doc, I've never take the flu shot. I had the flu once in my life. That's when I was a teenager in Jamaica. What I do, I try to eat as much vitamin C, oranges and grapefruits and strawberry. So talk to me. Tell me if I need to change that, because I'm going 72 right now.
Yeah, I mean, somehow, Paul, you've been very lucky, because none of those things prevent you from getting the flu. What they might prevent you from doing is to have a bad flu infection, right? So nothing really prevents you from getting infected with the flu except not being in contact with people who have it. So for example, I didn't used to take the flu shot, but then I started teaching large classes, classes with 400 or 500 students in them. And at certain time of the year, like now, you go into class and everybody's sniffling and sneezing. And I walk out of there with a flu infection, right? Joints aching, headaches, sore throat, other things, I get the flu. So it's not necessarily about what you're eating that make you not get it, but what you're eating is absolutely going to help you to overcome the harsh symptoms of it. So I would say keep on doing what you're doing. But if you start having conditions, health conditions that make you vulnerable, then that's a conversation to have with your physician. I take the flu shot every year because I'm in a setting where I'm in contact with people from all over the place on a regular basis, and as a result of that, I know I have to take it. When you have young children, they go to school, they come home with it, you're going to get infected with it. And I know people who do exactly what you do, and they have gotten knocked down by this flu season already. I have people in my church who live a very healthy lifestyle, extremely healthy, have no other underlying conditions, but they got knocked out for 2 weeks by this flu this season. So it's important to realize that nothing that we eat prevents us from getting infectious diseases.
Okay.
What it does is that it gives you a leg up, right? Those oranges, I wish I was at a place where I could eat oranges all the time, the way I used to eat them when I was back home, when they grew on our land. And eating those fruits with the antioxidants in them, with the high levels of vitamin C, all of that helps. In fact, just today in our health page from our bulletin, somebody had a formula for what we call the flu bomb. to prevent the flu. And of course, it's your oranges and your lime and your turmeric and your ginger and your garlic, and they give you the formula how to mix that. And I've had it myself. You're getting the flu's coming on, and that actually helps to lessen significantly the symptoms of the flu. And sometimes that's enough, Paul, that, the symptoms are so insignificant that you don't even notice that they're there. You have a little sniffle, you have a little sore throat, but it goes away quickly. You're not having full-blown flu for whatever reason. But that's more of luck and where you find yourself and the lifestyle that you have, rather than you actually having something that directly prevents it.
Okay. All
Yeah.
right. Appreciate it.
Hey, can I add this too, Doc? This is Dr. Holness speaking. I think most people, I hear a lot of my patients say they've never had the flu. I think most people have had the cold, and so you have the rhinovirus, but many people have had the flu. They may not have realized they had it. So that's one thing I do tell my patients. You may not have been knocked out, but the flu is very, very prevalent. It's hard not to get it. But the other thing is our immune systems vary so much. So that some people may get hit hard with it versus some others with comorbidities may get severely hit with it. But I would say this, Paul, as you age, your immune system does get easily more compromised. So you have to be very careful. That's the reason why the guidance is after the age of 50 or 60, they're starting, they talk more about the vaccinations and the pneumonia vaccines and the shingles vaccines and some of the others, because we're at higher risk because of our age for those things. So
Absolutely. Agreed. So you're getting it from the clinician.
Appreciate it, Doc.
Yeah. Wilbert. Wilbert, your hands are raised. Hand is raised. You have a comment there?
Yeah, Dr. Webley, a question, quick question. There are some of us who have gotten the flu shot, but then we realized that the flu shot did not protect us from this new variant that is out there. That's out there right now. That is so virulent. And a vaccine has not been developed for the new to cover the new variant. What is your recommendation?
Yeah, it's a nuanced conversation, right, Wilbert? Because the new variant is a variant of your regular H3N2, which means that the vaccine that you have actually has an H3N2 in it. Right. It's just that this new variant has differences that are not totally covered by the vaccine. So it's not that the vaccine has zero effect. As I mentioned at the top, it's protecting at a rate of about 30 something to 40 something % in terms of preventing you from being hospitalized for the flu. So it's not nothing. And it certainly can prevent you from dying of the flu for sure. But it probably won't give you full-on protection where you're not feeling the symptoms and the harshness of them. And so, at this point in time, if you actually do get the flu and realize that even after you've gotten the vaccine, that it's not giving you the level of protection that you need and you're getting severely sick, then you certainly need to go to the doctor so that they can give you an antiviral, like Tamiflu or something else, if that is contraindicated, so that you can have extra ammunition to fight it. But I have no doubt that by next flu season, unless we've gone completely crazy in the United States, we will include subclade K in the flu vaccine, because now that it has taken a foothold, it's not going anywhere anytime soon. It's going to be circulating even more. Because, the flu vaccines, because it's so hard to predict what you're going to get for the next season, you have to make the flu vaccine before the flu season starts. So you have to make some prediction there based on what you're seeing in Europe and other places. And so, they predicted and made the vaccine before they knew that there was this new subclade in play. So my expectation is that WHO is going to recommend that subclade K be one of the vaccines in the vaccines, but be one of the antigens in the vaccine setup for the next flu season. But we have to get through this one. And I would say really just do the things that are prudent, wear a mask in congregant settings, especially if you have underlying conditions. Wash your hands often because that's one of the easiest ways to pick up the flu. While coughing and sneezing is an easy way to pick it up. People touch surfaces that infected people touch, and that's how you pick it up most of the times. If you're sick, stay home, and don't come out and infect other people. And in that way, you'll slow the spread of it, both in and around your family and congregants in church. But we've been making those announcements in church now, saying if you're sick, stay home. Watch us online. Wash your hands. Maybe instead of doing the regular handshake, if you do a handshake, you have to wash your hands after. People like my wife always have a hand sanitizer in their purse. But RSV is also going around, and norovirus is going around, and so there are other respiratory things. That's why we call them influenza-like diseases that you're having now, because not all places will test for it. Even though now I think many places are testing to see flu and flu clade.
Doc,
Uh,
how effective are those hand sanitizers?
They're pretty good as long as they're not out of date. As long as they're within the expiration date period, they're pretty good where the flu is concerned, because the flu virus actually has an envelope on its outer surface, which means that the alcohol in the hand sanitizer will have an effect on it. But it has no effect on norovirus, because norovirus doesn't have an envelope.
So Tamiflu is a OTC medication.
Yeah.
What makes it effective against the flu?
It has a certain level of effect against the flu. It's not that it's more effective than anything else. It does have its effects on the flu, but there's a host of other things that they're prescribing now. And PAHO actually has either PAHO or the WHO. Yeah, PAHO actually has a recommended list of treatments, for high risk. If you have a high risk of progression to disease versus if you have a lower risk. Right. So actually, let me put this in the chat because I think this is important for people, that it's not recommended for everybody. Your recommendation for treatment is going to be based completely on where you are as in terms of health risk. So, you have treatment for severe influenza, as opposed to non-severe. You have recommendations for individuals who are at high risk versus those who are not at high risk. So if you go down on that page, down to about page 15 in that document, in that PDF that I just shared, then you will see the medication recommendations coming from the World Health Organization.
Okay. Thank you, doctor.
Yep.
Yeah.
Okay, gentlemen, we have had a evening full of information. I'm tempted to say information overload for some of us who are less able to assimilate all that scientific data. But Dr. Webley, thank you very much for sharing your insights with us. And it has truly been you always educate us when you share with us, and we are all the more informed as a consequence of your insights this evening. Thank you very much. And gentlemen, this evening we have recommenced our Friends Talking Forum. We have reduced it from every week to once a month now. So hopefully we can have more men turning up. Please share the information and pass the information along. Next month, the second Saturday in February, we will continue with our forum. Just to let you know that I sent out a list of for the gentlemen who are in charge of each month for the remainder of the year. I will continue posting it as we go along throughout the year. And if you have any questions concerning those assignments, please let me know. And we look forward to having all of you gentlemen fulfilling those responsibilities of having guests, or you yourself sharing your insights with us during the year. On a personal note, I just wanted to inform you, gentlemen, that on the 21st of this month, I will be undergoing a surgery and I will be out of commission for a few weeks. However, I will still be on Friends Talking, but I'll be taking a sort of backseat while I recover from the surgery. So please pray for me as I go into this surgery on the 21st of January. And I ask that you keep me in your prayers along with my family. Again, thank you, Dr. Webley. And gentlemen, thank you very much for joining us this evening. Before we go, Dr. Wellington, would you care to pray for us to close, please?
Certainly.
Thank you, sir.
Let us pray. Heavenly Father, we give you thanks for the information that has been shared this evening and our ability to relate and make wise decisions for the health of ourselves and our families. We ask that you continue to bless this group of men, friends talking, that have been so valuable. This group has been so valuable to so many of us. And even those who are not able to make it this evening, we pray that you will reach out to them with your love and your mercy. Before we close, we want to put before you Marcel. He's your son, and you know everything about him and his situation. And so we just lift him up before you. All of us here this evening stand by him and ask that you will be gracious, that you will help, that we will be able to celebrate victory once again, because you honor your word that you will see us through. And so we consider this done, and we consider this victory. So we want to say thanks, Lord, for always honoring your word. And so we pray that you will continue to be with all the men on this platform and our families, and even others who may not be doing well as well. Pray for everyone. Bless us this evening. Thank you for what we have heard and those who participated. In Jesus' name we pray. Amen.
Amen. Amen. Amen. Gentlemen, have a good rest of the evening and God bless you all. See
Thank
you
you.
next week. See you next month.
You. Thanks, Doc.
Thank you,
Thanks.
Doc.
Good
Thanks,
night.
Doc.
Good night,
God
everyone. Thank
bless.
you. Thanks again.
Anytime.
Amen.